During a session, you might hear a therapist talk about crossing midline. So what is crossing midline and why is it important? Midline is an imaginary line that goes from your head down to the bottom of your feet, and it splits your body into your right and left halves. And crossing midline is when a body part, like a hand or a foot, crosses over spontaneously to the other side of the body to complete a task. So why is it important? Neurologically, lack of midline crossing could mean that the left side of the brain and the right side of the brain aren't communicating effectively. So it's important to have both hemispheres of your brain communicating well to coordinate learning and movement. Physically, when you cross midline spontaneously with a dominant hand, that hand is getting the practice it needs to develop fine motor skills. For example, handwriting requires a dominant hand. It requires one strong, specialized hand. If both hands are being used equally, then the development of hand dominance might be delayed, and then therefore fine motor skills might be delayed as well. So how do you develop midline crossing skills? You start with bilateral coordination activities, which gets both sides of your body working together. Activities such as pushing, pulling, or crawling. Then as coordination progresses, you can begin to use activities that incorporate using one strong hand and one assistant hand. An example of that could be cutting. One hand, the strong hand is cutting with the scissors, and the assistant hand is holding the paper. Another activity, you could do a lot of reaching activities, like card games. You could have one hand reaching over to the other side of the body to grab a card, and the other hand is resting on a table, the assistant hand. And keep in mind the most important factor of crossing midline is trunk rotation, which is this movement here. If you have unstable core muscles, then it may affect your ability to cross midline.